Hi, good morning. My name is Professor Tom Cherian. I am a liver specialist and a liver transplant surgeon. I founded South Asian Liver Institute, a hospital dedicated for patients with liver disease. Before I started this, I was the National Director of Liver Transplantation for CARE group of hospitals, previous to which I had worked for 17 years in London in King's College Hospital in the Department of Liver Transplantation. Overall, I have done about 600 to 650 liver transplants in my career so far. And one of the commonest things that people ask me is, Professor Cherian, what is the indication for a liver transplant? When does somebody need a liver transplant? In my view, it is very simple. A liver transplant is necessary when the risk of death is greater without a transplant than with a transplant. Therefore, the purpose of a liver transplant is to decrease the risk of death for patients. Now, you might ask, at what stage of liver disease is this required? Initially, for example, let's take one example, fatty liver disease. We don't need a transplant for fatty liver disease. Even the next stage, which is liver fibrosis, doesn't need a liver transplant. In fact, even the later stage of cirrhosis does not need a liver transplant. When we need a liver transplant is when the patient has reached a stage of decompensated chronic liver disease or decompensated cirrhosis. So you will want to know, how do I tell somebody has got decompensated? Well, the symptoms of decompensated disease is very obvious. Increasing jaundice. So if somebody is yellow, not getting better, you waited 2 weeks, still yellow, jaundice, what they call manja kamale. So if this is there, that is one of the signs of late end-stage liver disease. Blood vomiting. If somebody has ever vomited blood, that's a very dangerous sign, and that is an indication that they have gone past the stage of just cirrhosis and decompensated. Such patients at South Asian Liver Institute, we do not rest until they get an endoscopy, they have banding, so that the risk of sudden rupture is decreased. It is not removed, but it is decreased. Third common sign of end-stage liver disease or cirrhosis is ascites. When the fluid builds up in the abdomen and people are not able to breathe, they are not able to eat because the fluid is so tight. Initial stages of this fluid buildup, which we call ascites, can be treated with medications. At South Asian Liver Institute, we make sure these patients are seen by a liver surgeon and a liver hepatologist or a liver medical specialist, and if possible, we try to maintain these patients with medication so that we can try and postpone or prevent a liver transplant. But at some stage, if patients, despite our best medical therapy, all patients who come to South Asian Liver Institute are put into something called a LICAP program. That is a liver care program that monitors these patients. Our coordinators, even after the patient has gone home, calls them, are you okay? What symptoms are you getting? 6 weeks later, we repeat the blood test. So this kind of what I called monitored care automatically happens with us. And if despite this monitored liver care program at South Asian Liver Institute, if the patient is not getting better, then we feel the safest option for the patient is a liver transplant. Therefore, what I want to say to people is that do not be frightened of liver transplantation. There are so many of my patients who were children when they were transplanted. Now they're adults. The danger is that if you need a transplant and you don't have it done, you will slowly deteriorate. And one day you'll reach a point where you're so sick that even if you then decide to have a transplant, it is too late. The outcomes are very poor at that late stage of liver disease. So my advice is that transplantation is not an option for just fatty liver disease. It is not an option for simple liver fibrosis or even just cirrhosis. But if it is decompensated, then we should think about a liver transplant, prepare for a liver transplant so that we do not have the risk of death. My message is not to fear, but of hope. I want to say that the outcomes of transplantation are good and that you should not fear it. We will use it as a last option, but we will use it before the risk increases.